Hey everyone, this is Dr. Priti Avari. Let us begin with today's topic with gratitude. We will see face anatomy, muscles of face. These muscles are different from other muscles as they lie in superficial fascia. They originate either from bone or fascia, and the muscles are not inserting into the bone but they insert in dermis of the facial skin. So when they contract, they help in giving various kinds of facial expression. So they are called as muscles of facial expression. Around the openings as nostril, mouth, eyes, they have two groups: sphincters, which will close the aperture, and dilators, which will open the aperture. The muscles of face develop from second pharyngeal arch, so they are innervated by branches of facial nerve. We will see orbital group first. So here we have orbicularis oculi muscle, having two parts, a palpebral part or orbital part. Palpebral part is present within the eyelids. So when this palpebral part will contract, we will be able to close the eyes gently. Second is orbicular part. When it will contract, it will close the eyelids very forcefully as if something is entering in the eyes, like when there is some dust entering inside or too much sunlight is entering inside, we try to close the eyelids very forcefully. So that time orbicularis oculi is working. Above them, we have a muscle which is attached to the frontal bone, and laterally it is entering into the skin underneath the medial side of the eyebrow. That muscle is corrugator supercilii. When it will contract, it will draw the eyebrows medially. I have taken one more muscle here, the muscle of the forehead, frontalis. We have seen this muscle in the scalp, but I have taken it here also because it's a part of face. The muscle fibers are originating from the dermis of the skin underneath the eyebrows, and the fibers are going vertically up, inserting into the gallia aponeurotica. When this muscle will contract, it will produce horizontal wrinkles on the forehead. In nasal group, we have procerus, vertically placed muscle fibers. When it will contract, there will be production of transverse wrinkles on the bridge of the nose. It's a very small muscle attached above the bridge of the nose. We have nasalis three parts: transverse, alar, and depressor septi. The transverse part is present transversely on the nose. You can say on the lateral wall of the nose. So when this part will contract, there will be compression of nasal aperture. We have alar part attached to the ala of the nose. So laterally going down, this is ala part. When it will contract, it will open the nostrils. So when we are like breathless, that time we can see the nostrils are opening widely. That's because of the ala part. Attached to the nasal septum, there are two on the right and left side. Now in this picture, they are shown little bit widely on the sides, but they are present in the philtrum, and above they are attached to the lower border of the nasal septum. When these two muscles will contract, they will pull the nose and nasal septum down. So this is the nasal part. We have oral group. We have many muscles in the oral group. First, we will see the muscles in the upper part. Let us say related to the upper lip. We have levator labii superioris. So this is the levator labii superioris muscle. The muscle fibers are going vertically. When it will contract, it will raise the upper lip and open the nostrils also. We have oral group. This in the oral group we have many muscles. First, we will see the muscles attached to the upper lip. So we have levator labii superioris aliquinesi, the medial most muscle. Fibers are going from the upper lip towards the eye. They are passing, let us say, to the maxilla and also to the lateral wall of the nose. So when this muscle will contract, it will raise the upper lip and open the nostril. Then lateral to that, we have levator labii superioris, vertically placed muscle fibers. When it will contract, it will raise the upper lip and help in formation of nasolabial furrow. We have zygomaticus major and minor muscles. These two muscles are going from the upper lip to the zygomatic bone and little bit obliquely placed. When these muscles will contract, they can draw the corner of the mouth upward and laterally, also helping in drawing the upper lip upward. So these are the muscles helping in smiling. Then a muscle attached to the angle of the mouth, levator anguli oris, going from the angle of the mouth to the zygomatic bone. When this muscle will contract, it will raise the corner of the mouth and help in formation of nasolabial furrow. We have muscles related to the lower lip, mentalis, a small muscle present in the middle, attached to the mental protuberance and going to the lower lip. So when this muscle will contract, it will raise and protrude the lower lip and produce wrinkles on the skin on the chin. Sorry. We have rhizorius, a very small muscle attached to the angle of the mouth, and the muscle fibers are going behind. So when this muscle will contract, it will draw the angle of the mouth behind. So it helps in retraction of the corner of the mouth. We have orbicularis oris, a huge muscle which is forming mass of the upper and lower lip, and the muscle fibers are circularly arranged. So when this muscle will contract, it will help in closure of the lips and protrusion of the lip when very forcefully contracted. Very important deep present muscle, buccinator muscle. When this muscle will contract, it is going to press the cheek against the teeth and it will compress the distended cheeks. We have depressor anguli oris. So there is a depressor anguli oris muscle attached to the angle of the mouth from here going to the mandible. So when this muscle will contract, it will draw the angle of the mouth down. Just medial to that, we have depressor labii inferioris attached to the lower lip and below it is attached to the mandible. So when this muscle will contract, it will draw the lower lip down. Very important muscle of facial expression present in the neck called as platysma. It originates from the skin over the clavicle, and a thin sheath of fibers run over the neck to reach till the base of the mandible. It covers both anterior triangle and posterior triangle of neck. It is innervated by cervical branch of facial nerve. When this muscle will contract, it produces horizontal wrinkles on the neck. Underneath this muscle lie a superficial vein of the neck called as external jugular vein. So we have seen these muscles. So I have taken few of them as example for various facial expressions. Like for smiling, we have zygomaticus major muscle. When we are doubt, our mentalis is working. In surprise, the frontalis is working. When we are sad, our depressor anguli oris is working. When we are in anger, the the nose is dilated because of dilator nares. And in case of horror, when we are too much frightened, our platysma is working, which is producing horizontal wrinkles on the neck. After this, we'll see nerve supply to the face. The motor nerve supply to the face is done by facial nerve, a seventh cranial nerve. The facial nerve enters in the face through stylomastoid foramen, where it passes through the parotid gland, divides into temporofacial trunk and cervicofacial trunk. They again divide into temporal branch, zygomatic branch, upper buccal, lower buccal branch, marginal mandibular branch, and cervical branch. The temporal branch will innervate to muscles present over here like frontalis. Zygomatic branch will innervate muscles in relation with zygomatic bone and the lower part of orbicularis oculi. Upper buccal, lower buccal will also supply to muscles in relation with upper lip, lower lip, and cheek. The marginal mandibular nerve, it is passing, let us say 1 to 2 centimeter lateral or below the angle of the mandible, and it enters in the lower part of the face to supply muscles over the mandible. The cervical branch is entering in the neck to supply platysma. The sensory innervation to face is done by various branches of trigeminal nerve and greater auricular nerve. So this picture is showing how various parts of the face are innervated by different branches of trigeminal nerve, like the tip of the nose, the lateral sides of the nose, you can say whole of the nose, the upper eyelid and forehead, they are innervated by ophthalmic division of trigeminal nerve. Then we have second division of trigeminal nerve, maxillary division. It is innervating to the lower eyelid, the upper lip, and the upper part of the cheek. The mandibular division is innervating to the everything related to mandible here, the lower lip, and lower part of the cheek. The skin over the angle of the mandible is innervated by a branch from cervical plexus, that is greater auricular nerve. Root value cervical 2 and 3. Here I have tried to show you various branches of trigeminal nerve supplying to the face. First, we'll see branches of ophthalmic division. There are 5 branches. I showed here 4 only. So we have supratrochlear, supraorbital, lacrimal, infratrochlear, and external nasal branches of ophthalmic division. Branches from maxillary division, main continuation of maxillary called as infraorbital nerve. Then we have zygomaticotemporal, zygomaticofacial nerve. Branches from mandibular division, we have mental nerve, buccal nerve, and auriculotemporal nerve. So we have done with the sensory innervation. Now we'll see the arterial supply to the face. A facial artery, the principal artery of the face. It arises from the external carotid artery. You can see it is arising from the external carotid artery in neck just above the tip of greater cornu. So you need to assume that the greater cornu is quite nearer here. In 2D it's not possible to show. So greater cornu of the hyoid is present nearer to this origin. And then it is leaving the carotid triangle, entering in the digastric triangle. In the digastric triangle, it will reach till the base of the superficial part of the submandibular gland. It winds around the base, winds around the gland, and it comes down to reach to the base of the mandible. It enters the face by winding round the base of the mandible at antero-inferior angle of masseter. So here, the masseter muscle is present on the ramus of the mandible. The facial artery is exactly entering where the anterior border of masseter is present. So what is important here is when we want to do peripheral pulsations, we want to take pulse on facial artery. We can palpate the facial artery here just anterior to the masseter muscle. In the face, the artery will lie 1.25 centimeter lateral to angle of the mouth. So you can see the facial artery is running up obliquely. So as it is going up, it will lie 1.25 centimeter lateral to the angle of the mouth. Then it ascend by the side of the nose to reach till the medial angle of the eye. The artery is tortuous so that it can allow the movements of the mandible, lip, and cheeks. Otherwise, there are chances that we might kink the artery. We, we will see now venous drainage of the face. Very beautiful picture. I tried to make it myself. Let us try to understand in this. I loved this picture actually. The supratrochlear vein and supraorbital veins will join to form a vein on the medial nearer to the medial canthus of the eye, that is angular vein. The angular vein runs down, and here now onwards it will be called as facial vein, to which various veins from the sides, like veins from the cheek, veins from the nose, are entering inside, and this facial vein is running down obliquely. It will also get veins from the upper lip, lower lip, and finally it passes in the neck. In the neck, this vein will be joined by anterior division of retromandibular vein to form common facial vein, and the common facial vein enters into the internal jugular vein. It ends over there. So this is how the face is drained. The venous blood from face is drained. Now, what is dangerous area of the face? Let us try to understand. Now, this is a picture trying to show the connections between intracranial venous sinus called as cavernous sinus and facial vein. In this picture, you can see a pterygoid plexus of veins is present in the infratemporal fossa in the lateral pterygoid muscle. This pterygoid plexus of vein communicates with the facial vein through deep facial vein. Then, this lateral pterygoid venous plexus, it communicates with a dural venous sinus present within the skull called as cavernous sinus. Now, the area of the face where tip of the nose, lateral side of the ala of the nose, the philtrum, the skin over the upper lip, let us say complete upper lip, this area of the face is called as dangerous area of the face. Second thing is the facial veins and its communications are valveless. So if there is any kind of infection of this region, there are chances that infections from here can be carried by this communication till the cavernous sinus, a dural venous sinus present inside the skull. This can lead to thrombosis of this cavernous sinus, which is a very important fatal condition, emergency condition, as cavernous sinus is also draining the eye. So, to simplify, let us try to understand again. So, the facial vein can communicate with the cavernous sinus through many ways. I have shown here, but here I am explaining only the pterygoid plexus of veins. So, facial vein is connected with pterygoid plexus of veins through the facial vein, and from here the emissary veins are carrying venous blood to cavernous sinus. So all these veins are valveless. So if there is any kind of infection on the face, can be carried till the cavernous sinus through this route, leading to thrombosis of this cavernous sinus, which is quite a emergency condition. Now we'll see the last slide, that is lymphatic drainage of the face. Very beautiful slide. So we have various groups of lymph nodes here. A group of lymph node present in front of the auricle, preauricular lymph node. Which part of the face is drained by this lymph node? Lateral part of the forehead, lateral part of the upper and lower eyelids, lateral part of the cheek area, and upper eyelid. All these part is drained in this area. Then we have a group present just in relation with submandibular fossa along with the submandibular gland, that is submandibular group of lymph nodes. It is draining the central part of the forehead, medial part of upper and lower eyelids, then lateral cheek area, nose, whole of the upper lip, and lateral part of the lower lip. So this complete area will be drained by this submandibular group. Then we have a group present in the submental triangle, that is submental group of lymph nodes just below, in the, let us say, below the origin of the digastric, nearer to that area. Okay, so that is submental group. It is going to drain only the middle part of the lower lip and area of the over the mandible below that. So we have three groups here: the preauricular group, then submandibular group, and submental group. So we are done with muscles of facial expression, their nerve supply, both motor and sensory nerve supply, blood supply to the face, what is dangerous area of the face, and lymphatic drainage of the face. Thanks for listening. I hope you understood the slides. Please do like, share, and subscribe. Thank you.